Today is the first day of the vaccination at AstraZeneca so far.
Yeah, I think it's been really good. People have come on time, many early, very anxious and eager, and so far we've not had any complications and things have moved very smoothly. Generally, we've heard really good feedback, so we're very happy with that. Yeah.
So we are expecting about at least 1 million doses for AZ coming out this month.
Yep.
How soon can we expect the two more of our vaccine to be approved by MPRA, CanSino as well as Sinopharm?
Yeah. No, Sino.
CanSino and
Gamaleya
Sputnik 5.
Sputnik 5, yeah. So, CanSino and Sputnik 5, they are still waiting for some work from NPRA, looking at the documentation and so forth. We meet every week and we're given updates. So as soon as NPRA is happy with the documentation, we proceed.
How's the, looking at the warnings given by our health DG, Tan Sri No Hisham, about the possible fourth wave?
Yeah.
So today, starting tomorrow, we will have our targeted MCO in Selangor. What is your take in the coming next few months in the midst of the vaccine rollout?
I think the first thing we have to acknowledge is a global surge. It's not just Malaysia. Globally, we are seeing higher numbers. I think there
plus the mutations too, right?
Well, a few reasons for that. I think that after 1.5 years, people are tired and people have let their guard off. And not observing the SOPs as closely. The biggest challenge is actually the social distancing. I think masking, and now people put on the mask. The other thing, of course, is that variants are emerging. Malaysia is not spared from that as well.
Yeah, we're seeing the multiple mutations in India variant.
We're seeing the multiple mutations in India, and as a result, the disease is spreading in a way that's different. It just has a different pattern. It tends to, have much more virulence and so forth. So I think the bottom line is we cannot lose our sight on the public health measures. Testing, find, test, trace, isolate. We must, observe the non-pharmaceutical interventions.
And sorry, there's also another one. There's been calls to the government to be more transparent when it comes to the data, as well as what is the current capacity of our testing as well.
Yeah. So I think the testing capacity, DG always mentions it in his media statements. But you must remember that we can also use the RTK antigen as a screen, and that can be done by anyone, pharmacy, GP, and so forth. What we need to do is, just keep testing as many as we can. This is my personal opinion. I think we need to test as many as you can. And then, of course, with data, it's very important on also, you've heard of HIDE that was announced. I think this is a very good move that we actually can now use machine learning and artificial intelligence. We can pinpoint where the origins of infections are. So you actually target and zoom in on activities, and it shows it's the social activities that is causing the problem. And most of that is related to eating. As you know, Malaysians love to eat.
Yeah.
And that's the time when you take off your mask, right? So I think that's true. So I think that has to be done. And then, of course, the vaccination. I mean, this is our only hope. AstraZeneca, even with one dose, you will markedly reduce your risk. In fact, there's reports saying that after 24 days, the risk of getting severe disease is zero. So that's significant, and we need that second shot. I think we've got to encourage Malaysians not just to be happy with one shot, you have to come for 2 shots, right? And I think that should be our approach from now. Yeah.
All right, so what's your message to a lot of Malaysians out there who are still very hesitant?
Well, my message to Malaysians out there is that, number one, please, take care of our health system. If it collapses, we will not be able to save anyone. If it collapses, it means that the Ministry of Health and the doctors and the nurses will have a terrible time making decisions on who should live and who should die, because there's no health facilities. Luckily, we are not there yet.
Correct.
But we cannot, we must be prepared for the worst, right? And the only way we can avoid going to that direction is for us to take our own behaviors are very important, number one. Number two is that, we've got to encourage everyone to take the vaccine. No one is safe until everyone is safe, especially if you have older people in your families. they must be protected. Yeah. The third thing is that COVID is happening more. The highest incidence of infections is among the young.
Asymptomatic,
sporadic, but now they're appearing in intensive care because the disease seems to be increasingly severe in intensive care, and therefore, you know, it's also the young population that must come forward to be vaccinated. And fourthly, don't forget there is something called long COVID, and people are not talking about this enough. The long-term effects of COVID, fog brain, you know, aches, muscle aches and pains, long-term, you know, feeling unwell. So I think that, you know, we talk about the acute ICU. Remember, there's a long-term COVID as well that will go on. So I think, you know, we all have to live with this at the moment. We have to adjust how we live with it. But it's here to stay for a while, so we have to do our best.
Great.
Yeah.
Thank you so much, Sri.
Okay. No.